O0110 Special Treatment Procedure and Program. Now let's review O0110, which captures special treatment procedure and program patient receiving at a time of OSS assessment. This item helps to identify patient with more complex care need. This item include cancer treatment. In that, A1 chemotherapy, mark if the patient is receiving chemotherapy. A2 is for IV chemotherapy, chemotherapy administered to intravenous infusion. A3 for oral chemotherapy, if chemotherapy taken by mouth. A10 any other chemotherapy method not listed above. B1 for radiation, mark if patient is receiving radiation therapy. Next is a respiratory therapy. C1 oxygen therapy, patient receive oxygen therapy. C2 continuous, oxygen used continuously. C3 intermittent, if oxygen used only during certain periods. C4 is for high concentration, high flow or high concentration oxygen. D1 to D3 is for the suctioning, means a removal of secretion from the airway, scheduled or as needed. Even for the tracheostomy care of tracheostomy tube. F1 for the invasive mechanical ventilator, means ventilator connected to a tracheostomy. G1 for the non-invasive mechanical ventilator, ventilation without tracheostomy. G2, G3 BiPAP, CPAP. Other treatment include H1 IV medication, medication administered to IV. H2 for the vasoactive medication, that IV medication affecting blood pressure or heart function. H3 for the antibiotic, IV antibiotic. H4 for the anticoagulant, means IV anticoagulant therapy if there is. H10 other IV medication not listed. I1 for the transfusion, means blood or blood product transfusion. J1 for the dialysis, means treatment to remove waste from the blood. J2 hemodialysis, means dialysis through a machine. J3 peritoneal dialysis, dialysis using abdominal cavity. Next IVSS, in that O1 IVSS, O2 peripherally, standard peripheral IV line. O3 midline catheter. O4 for the central venous assays such as PACC, tunnel catheter or implanted port. Next last Z1 none of the above. If none of this treatment procedure or program applies to the patient, select Z1 none of the above. Always verify physician order, referral document and assessment finding before coding O0110. Incorrect coding can misrepresent the patient clinical complexity and skill care needs.